So we're going to hear from our sponsor, and then we'll be back. Again, we're live at the WABC studio, so if you don't want to hear about bladder cancer, if you want to hear about XYZ cancer, your cancer, call us at 800-848-9222, 800-848-9222. This is your show, a show for you. So if you have a topic you want to discuss or a question, call us at 1-800-848-9222. We have Russ in the studio who's taking your calls. He's here live along with me. And we'll be right back after hearing from the man with the golden voice. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back here live, taking your calls, taking your questions. You can call us at 800-848-9222, 800-848-9222. So, some of us out there, probably you, remember when Dan Rather got on the news and he said, Mrs. Reagan, the wife of the president, this is when she was in the White House, had breast cancer and therefore she must have mastectomy. And he announced that on the news. This was about 1982 or 1983. And I got on the phone and called up Dan Rather on CBS News. It was 6:30 broadcast, the nightly news. As in the old days when there wasn't cable, so there were only about 3 news programs. And I said, no, it's not correct. Breast cancer does not mean you have to have a mastectomy. Now, in those days, I was in Boston training in cancer treatment at Harvard, and we used to have women, we had some women who flew up on the Pan Am shuttle every day to have radiation just to save their breast when they couldn't have it in New York. So there was a big mentality difference and a big approach difference. Women would fight to save their breast. And today, there's long-term studies that actually show that for most women, if you have breast cancer, you can remove the lump of cancer and have radiation and have results equally good to mastectomy or even better, and keep your breast. So it's a dramatic change in a short period of time in our lifetimes where breast cancer does not mean mastectomy. Breast cancer means you have choices. And it's better to call us at 212-CHOICES and find out in advance than regret it later. Now, why am I talking about this? Well, number one, breast cancer affects many people, not only women. About 1% of people with breast cancer are men. It's mainly women. And I really want to talk about a study that was done about making radiation shorter. So some women choose not to get proper treatment, because they don't want to commit to weeks and weeks of treatment. So there was recently a study done by Whalen and published in the prestigious journal called New England Journal of Medicine that looked at reducing the time required to give radiation to women with breast cancer, reducing it down to 3 weeks. And guess what? The results are equal, with equal cosmetic results. So it's giving 16 treatments over 3 weeks. This is a randomized study. So women were randomly allocated to a 3-week course versus a 5-week course. It's treating women with invasive breast cancer who had lumpectomy. The margins were clean, meaning no cancer was left in the breast. Lymph nodes were negative, and the women were randomly allocated to receive breast radiation either over 5 weeks or 3 weeks, and then they were followed. And actually, the women, in fact, did even better who had the 3-week course. The recurrence rate was 6.2% versus 6.7%, which is fantastic results, excellent results. And the cosmetic results, with good or excellent cosmetic results, were equal in the two arms, because we want the woman not only to be cancer-free, but we want her to have a normal-looking, excellent-looking breast for the rest of her life. And the conclusions were 10 years after treatment, the accelerated course of treatment was equal to standard radiation who chose to keep their breast. So it's good, and good news, meaning, number one, you can keep the breast for most women. Number two, you can have excellent medical results. Number three, you can have excellent cosmetic results. So we've been devoted to excellent care for women with breast cancer for 30 years in New York, and we've been encouraging women to choose the treatment that each woman wants, not what the doctor wants, what each woman wants. And each woman is entitled to know all the options, to know all the data, like this data, that you don't have to have a prolonged course of treatment. You can have an accelerated course of treatment with equal results, excellent chance of being cancer-free, and to have an excellent appearing breast. So if you've got that lump, if you've had a lump, or if you've had a recent mammogram that's suspicious, give us a call at 212-CHOICES, 212-CHOICES, and we'll talk and meet and go over all the details to give you the treatment that works best for you, to give you your best outcome, the best cosmetic result, the best treatment that fits in with your lifestyle, and that's most convenient, best for you. So I want to change gears and talk about a gentleman who came to us this week with a lymphoma of the nasopharynx. Coming to work today, there was a sign, help treat rare cancers. It was a big billboard across from Macy's on 34th and 7th Avenue. Illuminated sign at 3 in the morning, bright, treat better rare cancers. Well, yes, we want to treat rare cancers and common cancers. We want to treat them all in the best possible way, not just rare cancers. But today I want to talk about this gentleman. He's about 50. Unfortunately, his wife died. He's raising his children himself. He has symptoms. He woke up and he was unable to hear. He saw an ear doctor. He was worked up. He had scans done. He was found to have a mass in his nasopharynx. Do you know where that is? Nasopharynx. It's part of your body. You've got one too. Well, take a guess. Nasopharynx, it's the area behind the nose, below the brain, above the mouth, that's leading into the oral pharynx, or the mouth area. So yes, there's a space there, And this man had a mass there. And the mass was occluding the eustachian tube, which is a little tube going to the ear. So when that tube was blocked off, he lost hearing. So his doctors did the right thing. They did a biopsy. They found a lymphoma of the nasopharynx. They put a tube in the ear to open up the ear so it could get drainage and get pressure equilibrium. And he chose to come to us to get staging, meaning to find out where this lymphoma is. And we're getting him staged with a PET scan to see exactly where it is, if it's only in the nasopharynx or if it's spread beyond the nasopharynx. If it's a localized lymphoma, it could be as little as stage 1, which means that he has choices. Yeah, he has choices. Doesn't necessarily mean chemotherapy. He came to us because he did not want chemotherapy. He wanted treatment that would resolve the problem, take care of this, allow him to get on with his active lifestyle and live a normal life. And that's the goal, I think, of most all of us. So he had a B-cell lymphoma in the nasopharynx. We're staging him up, and then we'll offer treatment depending on the stage. And he gets to choose what treatment is best for him and what's most appealing. And, of course, he'll have our guidance and help. So another patient this week, a gentleman with a Gleason 7 prostate cancer. So, again, you know that Gleason was a pathologist, and he tried to tell us how aggressive cancers would be. Rather than just say it's cancer, he made a scale, so you have a very clear, defined definition of the risk of the cancer. So he had a Gleason 7 cancer. This man had multiple medical problems, diabetes, high blood pressure, cholesterol, atrial fibrillation, and Gleason 7 cancer. So when he came in, he didn't know what his Gleason score was, didn't know what his PSA was. And that's the point of coming to us, to find out the stage, the aggression, the extent, the risk factors. Get copies. He now has a copy in his hand, and he has our book. And we're happy to provide that book to any one of you. If you want to turn to page, if you have the book, otherwise we'll send it to you at no charge. You can turn to page 14, and there is a big graph occupying most of the page of the results of Gleason 7 prostate cancer in our hands versus 2 famous cancer institutes in Boston and Philadelphia. And in Boston and Philadelphia, they have their results of radical prostatectomy, which is surgical removal, radiation, brachytherapy only, or brachytherapy and hormonal treatment. So the best results elsewhere for Gleason 7 cancer was 60%, 5-year cancer-free survival. You might say that's okay, it's a majority. But would you go there if you knew that our results were 90%, 50% better? So what a difference a consultation makes. What a difference a day makes. 24 simple hours. He was headed toward a 60% success rate when now he knows, coming to Radiosurgery New York, Dr. Lederman, it's 90% for Gleason 7 cancer. And it's right here on the graph, page 14. In fact, there's a whole book. We have 5-year data, 10-year data. Our results at 10 years are better than surgeons at 5 years. And we know that surgery has complications with sexual function and urinary function. There's a hospital stay, and we know the risks involved in going to the hospital with superinfections and complications and blood clots, not only to mention damage to the sexual and urinary function. So our patient, when he saw the results, wants to be in the 90% group, not the 60% group. He wants to avoid surgery. He wants to try to keep his sex life and his urinary life and his quality of life while avoiding radical surgery. So here is a man who has the chance of getting it all. Higher chance of being cancer-free for Gleason 7 prostate cancer. And in fact, the benefits are across the board, whether you have lower Gleason, like Gleason 6, which is the most common Gleason score in America, or even Gleason 8, 9, 10. If you look at Gleason 8, 9, 10, which is on the next page, page 15, you will see that our results, cancer-free survival,